So for the diagnosis of venous disorders, you need to know that what here when you want to put a diagnosis, that I've already told you, when you are putting a diagnosis in surgery, you put a diagnosis of the big topic. Is it clear? So here you may have the patient present with an ulcer. The big topic is ulcer. Is it clear? Now, after saying ulcer, you say probably etiology being venous obstruction. So you can say a ulcer, you say probably being a venous ulcer from either you can say now the cause which can be a primary venous insufficiency or a secondary venous insufficiency depending on what you have. Is it clear? So if you have an ulcer in this patient, you say ulcer probably being a venous ulcer with etiology being it can either be a primary venous ulcer or it can be secondary venous ulcer based on what you have done on your physical examination and you have found. Is it clear? So those are the different elements of the diagnosis that you have to bring out. So generally that's that for the diagnosis. So you just as I've already told you, you just bring out the big topic. Or if you don't want to say ulcer, you can say you see a patient that has a issue of a primary venous insufficiency or a secondary venous insufficiency. You speak about a venous obstruction. Is it clear? You can say a venous obstruction with etiology being you can have a deep venous thrombosis, or you can have a thrombophlebitis, or you can even have a primary venous insufficiency, and then you complete by saying complicated now by a venous ulcer. Is it clear? So that is the two ways. Either you can say from from the middle, that is what I've said, the disease, then you go up to the cause where you say the disease is a venous obstruction or a venous disorder. Is it clear? The cause here it can either be a secondary or a primary or secondary venous disorder. In primary venous disorder, we have valvular insufficiency. In secondary venous disorder, we have deep venous thrombosis. We can have thrombophlebitis, or you can have a central obstruction in the case of a malignancy obstructing the inferior vena cava. Now, for the complication, we said that we can have a venous ulcer. So she said that complication can be a venous ulcer. That is how you make your diagnosis in this case. In surgery, this is particularly this type of diagnosis is better to do that in internal medicine. Is it clear? Internal medicine, if you have this patient with ulcer that is being treated in internal medicine, is it clear? It's better to say it's a venous obstruction in this pattern. Is it clear? But when you are in surgery, you have a patient with ulcer, you need to know that what in ulcers in surgery, the major diagnosis in surgery is going to be ulcer, because there is a topic in surgery which is ulcer. But in internal medicine, there is no topic in internal medicine which is ulcer. The topic in internal medicine is venopathy or venous disorders. Is it clear? So those are the different things that you have to put in mind. Now, after talking about the venous ulcers, the diagnosis, we are now going to move now to the investigations.